Good morning. A few more minutes to go. Seeing a lot of people are joining today. Very important class. This is our Saturday morning, regular scheduled 9:30 Facebook Live class. We are doing through my page and also through Satik's page, Yoga and Healing Studios page. And most of you know by now, the Satik's page is a non-profit, a community yoga and Ayurveda center. And they literally survive on voluntary donation. Please try to donate. I think you can do the donation through Facebook. I'm not too good in Facebook, but I've been doing it for some time. Today, I'm also teaching a advanced yoga teachers training class. This is called from Zinnia Yoga Academy. And these are all certified yoga teachers who are joining us. They're also joining this practice. We're 7 students. And after the class is over, we'll take a little break. And then we'll continue our class until 5 o'clock today. Today is 8 hours class. Tomorrow is also 8 hours. So we have a 16 hours class this weekend, all through Zoom from home. It's a new experience for all of us. So, all these last few weeks, we are all talking about our present day crisis, COVID-19, the coronavirus. And today we'll talk about the yoga therapy to improve cardiopulmonary function to fight coronavirus. Cardiopulmonary means heart is cardio, pulmonary is lung, heart and lung function. I will be starting practice very soon because we like to do more practice. And as you know, the yoga is 99% practice, 1% theory. But today, just to give you a little bit of information about coronavirus is that all of you know the coronavirus is a droplet spread. It affects our lung first. The virus needs a live body, a human being or an animal. This virus is probably transmitted from 2 animals. It's called bat and pangolin. It's a combination of 2 viruses. But it enters the lung, attaches to the lung tissue, and it starts multiplying in the lung. And during the process, creates a profound inflammatory reaction called inflammation of the lung. What is interesting is that process of multiplication, it needs an enzyme called ACE, A-C-E, ACE2. ACE stands for angiotensin converting enzyme, which is responsible for our increasing of blood pressure for heart disease, cardiopulmonary disease. So people with a cardiopulmonary disorder, like heart disease, congestive heart failure, hypertension, or even metabolic syndrome, truncal obesity, diabetes, hypertension, heart disease, dyslipidemia, most of them are on a medication called ACE inhibitor or called ARB inhibitor, called angiotensin receptor blocker. And American College of Cardiology, American Heart Association came out with a statement in the middle of February that these are life-saving medication, please don't stop it. Even the virus works for the enzyme, and by blocking the enzyme level is high. People with a heart disease, they're on a 4 standard medication: aspirin, statin, beta blocker, and ACE inhibitor. And also in yogic tradition, our lung and heart is the same organ. But in fact, if you see a sequence of a person who is dying, the first they expire. Means last breath comes out, the lung stops. When the lung stops, then the heart stops. When the heart stops, then the brain stops. When the brain stops, all cellular function stops, people die. So if you look at the consequence of the coronavirus, the first one, the lung gets inflamed, the lungs started to get filled up with the fluid, then they have a condition called ARDS. ARDS is called Adult Respiratory Distress Syndrome, and you have to ventilate them. That's where the ventilator comes in place. The infection then goes back to the blood, called septicemia, and then called a septic shock, called multiple organ failure. After lung, the next organ to fail is a kidney, and finally the liver fails, and that is our terminal event. So by able to improve your cardiopulmonary function, we are able to resist and fight coronavirus. I will be using maybe little, not too many medical terminologies, because a lot of healthcare providers are watching my show, but I'll be explaining it to your yoga teacher and yoga practitioners level. The first, the whole practice of yoga, it is the Yoga Sutra of Patanjali, 196 sutras, of which 193 of them are to quiet down your mind. Chitta Vritti Nirodha, controlling chattering of your mind. Practice is called 8 limbs of yoga. Ashtanga yoga of Patanjali, Yam, Niyam, Asana, Pranayam, Pratyahar, Dharan, Dhyan, Samadhi. In the final outcome is a union of your body, mind, and spirit. Balance of your body, mind, and spirit is a profound relaxation response and activation of the parasympathetic tone. So simple asana practice, which our Patanjali Yoga Sutra gave us, Sthiram Sukham Asanam. Stillness, Sthiram is stillness, Sukham is happy, Asana is a pose. Breathing, you have to have a relaxation so the whole lung function becomes your effortless ease. We call it the dis-ease is counteracted by effortless ease. Lung is a balloon. Vital capacity is 4.5 liter. Residual capacity is 1.5 liter. Your 6 liter capacity, we only breathe 500 cc. That's called tidal volume. We have to learn how to breathe out, empty your lung, and to bring your oxygen back in. So increasing your tidal volume and increasing your called FEV1, the functional expiratory volume in 1 second. In fact, in medical term, FEV1, we consider it as the sign of health and sign of helping us, preventing us to fighting any outside diseases. The parasympathetic activation takes place through our activation of our vagus nerve. Vagus nerve is one of the cranial nerves. We have 12 cranial nerves. Cranial nerves means the nerves which comes from your brain, and the lower part we call it the brain stem. Rest of the nerves in our body comes from a spinal cord. When we were in medical school, you should remember all the 12 names: olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, hypoglossal. This was a part of our anatomy class. The vagus is the 10th nerve. The name vagus comes from the vagabond. That means it starts, it goes all over. It brings the parasympathetic tone or a supply to your lung, heart, and your intestine. So parasympathetic activation is called calm and digest. So as I said, at the end of the yoga practice is a whole parasympathetic activation, which is called a holistic practice. Holistic practice means we practice our whole body, mind, and spirit. But with our mind, especially in a Western trained mind, we are also reductionist. Give me a practice, give me a asana, give me a pranayama for a disease. It's not there, but still we have some which is called a reductionist holism. We are reductionist but still holistic. So I'm going to show you just now how to bring the parasympathetic activation a step by step when you don't have any time to do the whole relaxation response of the whole body and mind, which also I'm going to show it to you a little later. So if you know the anatomy of the vagus nerve, which as a yoga practitioner, you should know very well, because the vagus activation is our present day yoga therapy. There's a lot of concept today called polyvagal theory. Stephen Porges is promoting it, anterior vagal, posterior vagal. But the vagus nerves, it comes from your brainstem, it comes down towards your neck, and before coming to the neck, it gives a branch called auricular branch. Auricle means your ear. Auricular branch supplies, this is called tragus. See the in front of the ear, tragus, and the auricle, this cartilaginous part, and the canal, inner canal of your external ear. With external ear, middle ear, and internal ear. So you will see, we'll be doing the ear massaging and how to do it inside, how to do it to activate your vagus nerve. Then the vagus nerve comes down in the neck. It enters the carotid sheath. It's in between your carotid artery and internal jugular vein, and it supplies all the sphincters of your gastrointestinal tract. It's called the larynx. It supplies the laryngeal sphincter. In pharynx, it supplies the pharyngeal sphincter. Then on the right side, it comes behind your subclavian artery. Then it gives a branch called the recurrent laryngeal nerve. It turns upward and goes to the larynx. So when you're able to voluntarily constrict your larynx, which we do call it Ujjayi Pranayam. Ujjayi Pranayam, we activate the superior and inferior laryngeal nerve. In fact, we activate the vagus nerve. So on the right side, you will come down. Then you'll give a branch to your heart, called the part of your parasympathetic supply. It also supplies your called AV node, atrioventricular node, the main heart conducting system supplied with the vagus nerve. Slowly it will come down. It will enter at your gastroesophageal junction, the junction between stomach and esophagus. It goes behind. It becomes called a posterior vagus nerve. So you will see, we'll do the constriction of all your sphincters. We'll do called a Valsalva maneuver, called Korno-Rogantar Pranayama, to activate vagus nerve. We'll do a contraction of an anal sphincter to like a bear down to activate your vagus nerve. We'll do a little bit of very light Kapal Bhati Pranayama, which stimulates the anterior and posterior vagus nerve at the gastroesophageal junction. On the left side, the vagus nerve is a little different in its travel. It still enters through your carotid sheath in between your common carotid artery and internal jugular vein, comes down on the left side, but then it goes all the way down to the arch of the aorta. This anatomy, if you know, and the recurrent laryngeal nerve, which comes to the larynx, then it comes underneath the arch of the aorta, then comes high up. And then left side, it comes again, it supplies the left side of the heart, then comes down to the gastroesophageal junction, and it comes in front, called your anterior vagus nerve. So vagus nerve stimulation, vagus nerve blockage is now one of the proper therapy. And also the vagus is for all the profound parasympathetic activation is a vagal activation. So for example, we all say, the sex is very good for our life. The act of sex is a sympathetic. It's your active, but the orgasm is a profound parasympathetic activation. Okay, so let's start first from the ear. In the ear, I've seen this. This is called this is done in Thailand, in Bangkok. Bangkok, they do called a Thai massage. Thai massage is a profound relaxation massage. Then one of the technique they call a ear picking. In a ear picking, they go inside your external ear canal. And literally, it's like your swab, like a cotton swab, which you tell you not to put inside the ear all the time. But many a time, what they do, they wet that, they make it a wet, and they make a wet of their external ear canal. They put that slowly and slowly, they're massaging, they're creating, activating, stimulating auricular branch of the vagus nerve. And it's such a profound relaxation for these patients. So the first, if you want to practice with me, you can do put your hand in the tragus, then in front, and massage the tragus slowly, activating the auricular branch of the vagus nerve. Okay? Slowly you can bring your hand with the two fingers, massage your auricles. Very nice and simplest way to massage the auricles. You can always, in a yogic tradition, you do this. You bend your auricle, let it go. This is a very nice yogic practice. Yogic practice also say, pull your earlobes. These are all activating your auricular branch of the vagus nerve. Then you practice yourself. I don't tell you to put a cotton swab inside your ear, but if you wet the cotton swab and if you wet your ear, especially after you take a shower, you can gently put, and gently if you keep doing it, just turning it, you will feel a profound sense of comfort and relaxation. The pathway is again your auricular branch of the vagus nerve. You can always also, it goes a little bit behind. You can put your two fingers, go behind the ear, put two fingers, one in front and the back. Basically activating your auricular branch of the vagus nerve. Okay. Come a little higher up in your mouth. You will see it's called your Valsalva maneuver. Valsalva maneuver is a forced exhalation, and in yogic pranayama is called Corno. Corno means ear. Rogantor pranayam. Rog means disease. Antar means removal. You remove the disease of the ear. Basically what it is, from the middle ear. Middle ear is from the external ear, we have a membrane, called a tympanic membrane. In tympanic membrane, and the inner side is your called middle ear. From the middle ear, there is a tube connection to your upper part of your basically mouth at the back, called eustachian tube. And this tube gets blocked. Many a time you will notice it like you're in a plane. When the plane is coming down, you feel a pressure on your ear, and the tube gets blocked. So the technique of Corno Rogantor Pranayama or Valsalva is that you breathe. Remember, in yogic tradition, you always breathe through your nose. You don't breathe through your mouth. Okay? Again, just before that, okay, let me tell you another vagal activation, which we'll do soon, which is again in the same area of the vagus nerve. So the way to do it, you breathe out first in every yoga tradition. Take a deep breath in, then you close both the nostril and try to breathe out with everything closed. Try doing it. We do it even when a plane is landing, when our eustachian tube, this is called a Valsalva maneuver, or called your Korno-Rogantar Pranayama. Breathe out first, breathe through your nose, and hold it, don't breathe out. Then close your nostril, close your mouth, close everything, and forcefully try to breathe out. Activation of the vagus nerve. The vagus nerve is your cardiopulmonary protection, parasympathetic activation. Always breathe through your nose. In yogic tradition, there is no breathing through the mouth. When you breathe through your nose, your air goes through your nose, the air gets filtered. The nose, you're like your personal air conditioner. Outside air is warm, nose will cool it down. Outside air is cool, nose it warm it up. Then the air goes on the side, they're called outside the nose, called a turbinate. A turbinate guides the air to goes around the line of your sinuses in the mucosa. And the sinuses in the mucosa, when it's activated, it releases a substance called nitric oxide. And nitric oxide is a profound vasodilator. And nitric oxide is a mediator of your parasympathetic tone. Like the primary activator of parasympathetic tone is called acetylcholine. Acetylcholine, nitric oxide, cyclic GMP, these are mediator of parasympathetic tone. For sympathetic tone is epinephrine, norepinephrine are the mediator. Then the air goes down to the turbinate, goes behind, enters through the larynx, and comes to the larynx, upper part of the trachea, then divides into two bronchioles, goes to both the lung, and it stretches the lung. So what are the yogic practices we do to bring the parasympathetic activation? First, we very gently do call Bhramri Pranayam, bumblebee breathing. Bhramri Pranayam. Always remember, before the Bhramri Pranayam, always do a very effortless yogic breathing, breathing out longer than breathing in, and a gently call it 3 steps yogic breathing. For upper part, middle part, and lower part of the lung, in yogic tradition is called the Dirgha Shas. Dirgha means long, Swas is your breath. Practice Dirgha Shas. So, in a Bhramri Pranayam, you close all of your 5 senses. Remember, the 5 senses activates us. We hear, we see, we smell, we taste, and we touch. When you shut down your 5 senses, then you create a vibration. That vibration through your nostril is a very relaxing activation of parasympathetic tone. That vibration also have a frequency of your brain. So 2 frequency interacts, it creates called harmonic resonance, and also mind quiets down. So a daily practice of Bhramri Pranayam, bumblebee breathing, that's what we need to improve your cardiopulmonary function. So we'll do it about 2 or 3 times. If you're with me, let's do it with me. This is the practice. Remember, I talk and we practice so you understand the underlying concept so you can keep on doing it. Put your index finger in your forehead. Use your 3 fingers to close your eyes. Use your thumb to close your ear and close your mouth. So literally what you have done, you have closed your vision, you closed your hearing, closed your mouth, and then you breathe out through your nose first. Breathe in through your nose and breathe out with the sound of a beak. Slowly bring up both the hands. You keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, this is called palming and cupping. You remove your glasses, take the hands like a cup, put it over your eyes, let the eyes take all the heat from your hand, then massage your forehead, massage your eyes, massage your face and head and neck. It's a wonderful activation. Another activation is simply what you do at the beginning of a yoga practice, that you have create a frequency. Frequency in yoga is called the sound of your Om. Om has a 3 component, A, U, Ma, A, U, M. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. So a 3 Om also activates your parasympathetic tone. So we'll be going at a step by step, the vagal activation, all the way up to your lower part of the gastrointestinal tract. As you know, the parasympathetic tone is called calm and digest. So let's do a 3 Om chanting with a component of A, U, M, and you'll all do through your nose. And do a mudra. This is called your Gano Mudra or Dhyano Mudra. This is a very important mudra to quiet down your mind. Another mudra to quiet down your mind is called Vayu Mudra. Put index finger down. It quiets down your vata. In fact, we'll be talking about Ayurvedic yoga therapy today in our yoga teachers training class. And all the students are also participating on this practice. We'll show it to them. Vayu Mudra, controlling your Vayu. So this Gano Mudra, it also balances your Pitta. And this is called Prithvi Mudra, touching your ring finger and thumb. This is called your Prithvi Mudra. It balances your Kapha. The same way like a Pranayama. Most of you know the practice. Alternate nostril breathing, Anulom Vilom Pranayama. It's called a Vayu Pradhan Pranayama. It balances your Vata. Sitali Pranayam, Chandra Vedi Pranayam, left nose, balances your pitta. Kapal Bhati Pranayam, call it Agni Pradhan Pranayam, it ignites your Agni, balances your Kapha. So touch your index finger and thumb, just put gently over your knees. Keep your spine straight, which is a minimum requirement for yoga practice, called Merudanda Achal and Manasthir. Breathe out first. Take a deep breath in. Then you put your both the hands touching in front of your heart chakra, Anahata chakra. Bow your head a little bit down and say Namaste, Namaskar. This is your honor the divinity within you. Activate the heart chakra, and it is also a profound vagal stimulation. As I said, the vagus nerve is also coming down along the side of the neck in between your carotid sinuses, your carotid sheath in between your common carotid artery and internal jugular vein. There is another organ called your carotid sinus. It's a little bit of collection of the nerve tissue. Carotid sinus is also, when you stimulate or activate, it's a profound vagal stimulation. So for the cardiologist, when the heart rate goes high up, say your ventricular tachycardia, there is a heart rate, they massage the side of the neck. It is called activating your carotid sinuses. This is near the bifurcation of the carotid artery. So the massaging your neck, like it's very nice massaging back and forth, is a very nice activation, like doing this, So that's what we do when you do your pumping and cupping. We bring it down. We do like this. And many a time, you have seen a yogic tradition. They will, after that, they'll pull the earlobe down, and also they slap both the ear like this. We do it, and now we know the causes, this activation of the branches of the vagus nerve. Okay, so we have come down to your, also at the level of your larynx. Before that, also you can remember one thing. Your eye, there is a practice called Tratak. Eye is very important. So remember eyes like, if you see the cranial nerves, okay? First was olfactory. It takes care of our smell. There's an optic. Optic nerve is behind your eye, your retina. It goes directly to your brain. So eye is a really communicator to your brain. Able to control your eye movement is also a very relaxation technique. Third cranial nerve is called oculomotor. Oculomotor means, oculo means eye, motor means movement. It causes the movement of the eye. Fourth is abducent, fourth nerve. And we used to call it SO4 LR6. There's a muscle in the eye called superior oblique muscle that's supplied by the individual, one single cranial nerve. Trigeminal is the fifth, that is mostly your sensory, and your LR6, lateral rectus, is supplied by the abducent or the sixth nerve. So look at that. 4 cranial nerves: optic, oculomotor, abducent, and your LR6, trigeminal trochlear. So when you do that, this is a different practice. I think we'll do it maybe at the end. We'll do a Tratak. We did last time, the Tratak, Jyoti Tratak, looking at a flame. But we can do it with our hands. But before, let's come to your larynx now. Able to stimulate the larynx, that you are trying to constrict your larynx, but completely relaxed way. You don't create any tightness. Before that, you can also do a little bit of relaxation of your neck and the back. And this is also done through, called pumming, through pumming. You rub your hand, you feel the warmth in your hand. When you feel the warmth in your hand, you put your one hand in the front, one hand in the back, and it just brings a profound relaxation and activation of your branches of your main branches of the vagus nerve. So in Ujjayi Pranayama, you will be slowly and slowly tightened up your larynx, totally effortlessly, and it will stimulate your superior and inferior laryngeal nerve. In a vagus nerve, very interesting is, about 80% of your impulse is sensory. Sensory means called a afferent. Afferent means all the information going to your brain. We call it brain stem. Only 20% comes out, it's called efferent. E for expel, A for admit. E comes out efferent. Only 20% is a motor function. So when you are able to stimulate that superior and inferior laryngeal nerve, you stimulate the vagus nerve. And from the brainstem also, the signal comes through glossopharyngeal nerve and hypoglossal nerve. Glossopharyngeal nerve supplies your palatopharyngeus and palatoglossus muscle in the soft palate, tightens up the soft palate. It literally cures your snoring. It supplies your hypoglossal nerve. The tongue is pushed in the front. It corrects your sleep apnea. So Ujjayi Pranayam is a powerful tool for your snoring and sleep apnea. And also you will see, I will show it to you next practices, one is called a Chinlock, Jalandhar Bandha. Then we'll be doing the breath holding in the lung, how to stretch the lung. When you stretch the lung, then we'll come to, it's called the Abdominal Lock, Uddiyani Bandha. Then look at the Mula Bandha, your contraction, your anal sphincter and pulling it up. These are all activation of your parasympathetic tone and relaxation. And you'll be seeing me, when I'm doing the Ujjayi Pranayama, I will be able to do a Uddiyani Bandha at the same time. This is a little advanced Pranayama practice, but total vagal activation. Again, for the hand get relaxed when you do called Balo Mushti Mudra. Try with me. Balo Mushti means the baby. Balo means baby. Mushti, baby will close their hand like this, thumb inside and close. When you do that, when you put a thumb inside and close, you bring the relaxation in your hand. If you get a pain in the hand is primarily from your tightening of the joints. So do the Balo Mushti Mudra. You're bringing relaxation in the upper part of the body. and gently close your larynx. Try to breathe in. It will create a sound like this. Or you can start at the beginning, slowly closing the larynx, both in and out. Is very, very subtle. We call it the Loghu Ujjayi Pranayam. But for a therapeutic pranayam, you do the full Ujjayi Pranayam. So typical Ujjayi Pranayam will look like, you breathe out first. Take a deep breath in. Breathe out completely. This is perfect Ujjayi Pranayam. Why? I had a cough. Cough comes from the larynx, from where the vocal cord is. When you have a cough, that means your Ujjayi Pranayam is properly correct and active. Let's try one more time. Breathe out first. Take a deep breath in. Completely breathe out. Perfect. Perfect Ujjayi Pranayam. But you will see, notice also, Ujjayi Pranayam is so relaxed. When I'm doing Ujjayi Pranayam, you will see my abdominal wall will go in. That is called your Uddiyani Bandha. Uddiyani Bandha, abdominal lock. Abdominal lock is also activation of your parasympathetic tone. Abdominal lock increases your negative intra-abdominal pressure. So when the intra-abdominal pressure is negative, you get a better perfusion of the organ, better perfusion of the liver, kidney, spleen, stomach, all the perfusion gets better. Could the perfusion get better, nerve supply gets better, that's what we call the proper function of an organ. In Ayurvedic term, we call them Agni, Jathar Agni, Bhuta Agni, Agni of your liver, Kloma Agni, Agni of your pancreas. So after that, you will come up to here, your Ujjayi Pranayam. You can do your pharyngeal sphincter. You can do your gastroesophageal sphincter. You can do your anal sphincter. So you can do all the sphincter together. It is like closing the whole system and trying to bear down. So we'll do a Mula Bandha. Mula Bandha, you will see, will constrict our anal sphincter, trying to pull it up, and we are trying to bear down as if you're trying to have a bowel movement. Remember, the whole gastrointestinal tract is supplied by parasympathetic nerve. And look at what is happening to me. I have a saliva in my mouth. When you have a saliva in your mouth, that means your parasympathetic tone is active. When you have a, say, you have stress, when you're fearful, mouth becomes dry. Then here I am, I'm talking over maybe 45 minutes, Didn't take any water, but still see my whole mouth is wet. I'm having parasympathetic activation. So try this again. Again, have a relaxation. Adhi Mudra, put it over your knees. Contract your anal sphincter, pull it up, close your mouth, and close your pharyngeal sphincter and try to bear down. Wonderful experience. I showed you last time the yogic practice in the morning called Ushapan. You sit down in a Malasana, squatting pose, drink a glass of water from your copper vessel, and in the room temperature, swallow in a gulp. When you swallow a gulp, it stimulates your peristalsis, contraction of your intestine. And in the stomach, when it comes, it creates a gastrocolic reflex. Stretching of the stomach contracts your colon, and sitting in your Malasana, squatting pose, your rectosigmoid junction becomes straight. You get a proper bowel movement. When you get a proper bowel movement, that is also a relaxing parasympathetic activation, vagal tone, which is good for a cardiopulmonary function. Next one, we will do a very profound yogic practice. It's called a Murcha Pranayam. Murcha means unconscious. It is so relaxing that you feel like you're almost unconscious. And what are the physiology behind it? So I tell you the physiology behind it because I have all the healthcare providers or a lot of physicians who are watching my show. And I do all my courses, a large number of physicians comes. When you do a chin lock, when you try to bring your chin close to your chest, you activate your carotid sinus. Carotid sinus is a profound relaxation to your cardiovascular system and also your nervous system. Then we'll take a deep breath in. Remember, you always breathe out first. Take a deep breath in and you hold your breath. It is called Kumbhaka. The breathing technique in yogic tradition for this is called a Puraka. Puraka means inhalation. Kumbhaka, Puraka, Kumbhaka is your breath holding. Breath holding in inhalation. After you breathe in, you hold breath, you call your Abhantarin Kumbhak. Then you have exhalation. Exhalation is called Rechuka. And then is called your suspension. Means breath holding in exhalation. Inhalation, retention, exhalation, suspension. When you do all the sequence, this is called a Savitri Pranayam. Savitri Pranayam also is a very profound relaxing response. So combination of your chin lock with a breath holding in inhalation, with Abhantarin Kumbhak, Jalandhar Bandha with Abhantarin Kumbhak is called a Murcha Pranayam. Okay, let's start just a simple chin lock. Simple chin lock will be, you continue your breathing, you don't hold your breathing. Breathe out first, take a deep breath in, slowly breathe through your nose, exhalation longer than inhalation, probably about 1.5 or 2 times. Very simple. If you cannot sit in the ground, sit in a chair. So my eyes are closed, my hands are relaxed in an Adhi Mudra, putting it gently over your knees. I'm breathing out and breathing in normally. Breathing out first. Take a deep breath in, and I keep my neck straight. I don't bend your neck. My eyes are closed. Slowly drop it down and try to bring my chin towards my chest. And I stay here. Breathing normally, exhalation longer than inhalation. It is activating your carotid sinus, activating your vagus nerve, parasympathetic tone. Remember what I said? It supplies your cardiac plexus, vagus nerve. It also supplies your atrioventricular node. We know the conducting system of your heart. Then it will create a few other phenomena. These are little medical terms, but it's very commonly understood, is that since it is a profound relaxation, it opens up all the peripheral blood vessels. It reduces your peripheral resistance. Peripheral resistance is reduced, blood pressure comes down. Peripheral resistance is reduced, and heart can function better, called reduction of the afterload. And when you do a better pranayama, exhalation longer than inhalation, effortless pranayama, you create a more intrathoracic pressure, called negative intrathoracic pressure. You have a better return from inferior vena cava to the heart. It is called a better preload. Better preload or increase in the preload, reduction in the afterload. It is the called improvement of your ejection fraction. Ejection fraction is a function of your heart. That is the improvement of your cardiac function. For the asana, backbends, backbends also increases your ejection fraction. But the other part of the lung is called a stretching of the lung. When you hold a breath called Abhantarin Kumbha, breath holding and inhalation, the lung will start to blow because it's like a balloon. But it does not. It stops at a certain point. What is a certain point? That is called a Herring-Brewer reflex. The medical terms, but if you can Google it, you will find Herring-Brewer reflex. In Herring-Brewer reflex, it is a vagal activation. Remember, the vagus is trying to keep heart, lung, and whole gastrointestinal tract in proper order. So telling the lung, don't inflate anymore. Go back to your original place. Herring-Brewer reflex. Activation of your parasympathetic tone or vagal tone. How do we do it? We do it with a breath holding in inhalation, Abhantarin Kumbha. But to improve more of the vagal stimulation, we also do a Jalandhar Bandha, your Chinlock. So let's try Chinlock with Abhantarin Kumbha. I'll show you one time. We'll do it about 2-3 times. You'll see, because this is a profound practice which you need to do to improve your cardiopulmonary function. And we can guarantee you, we have been looking at the people who are doing a daily practice of yoga. Are they getting infected with the coronavirus or not? It is a nationwide, international-wide sort of, subtle studies are going on. Again, with your Adhi Mudra. Breathe out first. Take a deep breath in. Hold your breath and slowly do a Chinlock. With your eyes closed, you will feel a lot better relaxed. Now you keep counting how long you can hold your breath. The best way to count is 1 and a 2 and a 3. Don't have any effort. When you have an effort, you let go. And we'll do it a couple of more times. Let's do it all together. Yogic name, Sanskrit name, Murcha Pranayam. If you're practicing with me, let's do it a couple of more times. Breathe out first. Take a deep breath in. Hold your breath with a chin lock. Very important practice, Mursha Pranayam. We recommend it for even non-curable diseases from Western medical standpoint. And we see a lot of benefit out of it. One more time. Breathe out first. Take a deep breath in. Hold your breath and bring your chin down towards your chest. Breath holding for 20 seconds is good. 40 seconds is great. 45 seconds is perfect. 1 minute, you are almost yogi. 2 minutes, you are yogi and yogini. You know, people who does for living, like scuba divers, they can also do it for almost 8 minutes. World record, 8 minutes. 17 minutes with oxygen in. They take a little oxygen before, they can hold for 17 minutes. Okay, you're keeping going down. Remember, auricular branch, laryngeal branch, all the eye nerve, optic nerve, oculomotor nerve, abducen nerve, SO4, LR6. We all remember this thing. These are pure, simple anatomy. Carotid sinuses, Chinlock, and lung stretching, called Herring-Brewer reflex, and exhalation longer than inhalation. Activating your vagus nerve, anterior and posterior vagus. In fact, we used to do a contours vagus nerve called the vagotomy. We used to do a vagotomy as an operation for your peptic ulcer disease, which you don't do it anymore. Because now we know peptic ulcer due to is a bacteria and is very well treated with the antibiotics. But it is there at the gastroesophageal junction. That's why, the Vamandhoti. Vamandhoti is a profound relaxation. I showed it to you in the last time. It's called your washing your stomach. Vastradhoti, Dandadhoti, washing your stomach. So you will do a first little activation with your Uddiyani Bandh, abdominal lock. Then remember the few things. You do a very simple, gentle Kapalbhati Pranayama. Kapalbhati Pranayama is a relaxation. It's a pranayama. Kapalbhati Pranayama done very rapidly is a kriya. That is called a Shat Kriya. Shat Kriya is the Sharir Shuddhi. Sharir Shuddhi, very important. And if you're sitting down, one thing you need to do always, you need to always change your feet, which I've been doing it and not showing it to you. That is, brings a balance back in the body and mind. So abdominal lock, then we do called your Mula Bandha. Mula Bandha is your root lock. Just give me a minute. I'm just running out of my battery here on my cordless phone. Let me. Okay, here we go again. Coming back. Next activation is your Uddiyani Bandh. What is Uddiyani Bandh? Uddiyani Bandh is a increase in the negative intra-abdominal pressure for proper perfusion of intra-abdominal organs. You know, here you cannot show your body too much, but in India, we can show it. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. You can keep on holding for a little longer and longer. And generally in our practice, what we have seen, breath holding in exhalation is generally about half of your breath holding in inhalation. If you can do a breath holding in inhalation about 40 seconds, you'll be able to do 20 seconds. At the beginning, again, remember, the whole practice is done completely effortlessly. Maybe 10 seconds, 5 seconds. Meet where you are and slowly progress. In stages, impossible become possible. Let's do it a couple of more times with Uddiyani Bandh. Then you do call a Agnisar Kriya. Agnisar Kriya is also activation of your parasympathetic tone. And you can incorporate, you can do your Uddiyani Bandh with your Jalandhar Bandha. And then you do all the three: root lock, Mahabandh, it's called Mahabandh, great lock, Mula Bandha, Uddiyani Bandha, and a Jalandhar Bandha. Again, you do Adhi Mudra. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold, and then do a chin lock at the same time. When I do it very quietly on my own, I can do it a lot longer than this. It is a purely your personal practice. You can do your Mula Bandha. Mula Bandha is you breathe out first, take a deep breath in, breathe out, contract your anal sphincter and pull out the whole pelvic floor and hold it along with lower part of the abdomen. In Western medicine, we do call a Kegel maneuver, K-E-G-E-L, Kegel maneuver. It is very good for your urinary incontinence, very good for improving your pelvic floor function. Another pelvic floor function is your The Sanskrit name is called your Prasharito Uttanasana, means wide spread, head down to your ground with Kapal Bhati Pranayam. Prasharito Uttanasana with Kapal Bhati Pranayam. Profound pelvic health. So let's do one time just the root lock, Mula Bandha. Remember, these are all in relaxation. See, when you do even a Ujjayi Pranayam, when you do, you call it accessory muscle of breathing. When you do, those are tightness, those are sympathetic. You want to do, you have to do with a smile in your face. Breathe out first. Take a deep breath in. Completely breathe out. Contract your anal sphincter and pull it up. You feel a profound sense of relaxation. How do I know? Saliva in your mouth. More and more saliva in your mouth, more and more is parasympathetic activation. Okay, let's do all the three locks together. This is called your Mahabandha, great lock. You will do your root lock, abdominal lock, chin lock at the same time, but you will be in a breath holding in exhalation because of your abdominal lock, Uddiyana Bandha. So breathe out first. Take a deep breath in. Completely breathe out. Contract your anal canal, pull it up. Suck your stomach in. Drop your chin down towards your chest and stay in this posture. Wow. See, I'm showing you in step by step how to do from the head all the way down to your toes. How to create a vagal nerve activation, parasympathetic activation. In a medical term, it's called craniosacral outflow. Cranial means head, sacrum is there, all the way down to your spine. Craniosacral outflow is your parasympathetic. And thoracolumbar outflow is a sympathetic. Means all the nerve coming out from your spinal cord between thoracic and the lumbar area are sympathetic. So a slow, gentle forward bend is also parasympathetic because it reduces your sympathetic tone. Let's show you a Agnisar Kriya. Agnisar Kriya is able to do your Uddiyana Bandha and then move your abdominal wall to massage all the organs. But remember, totally effortless, totally relaxed. How do you know totally effortless and relaxed? Talking, breathing. In fact, you are singing. If you can sing during your yoga practice with a smiling face, that is your yoga. Disease in Sanskrit called ashuk. Sukh, there is no shuk, no happiness. This is effortless ease your practice. Try it. Again, all yogic practice. Hands relax. Breathe out first. Take a deep breath in. Completely breathe out. Wow, what a practice. You might see a little bit of abdominal wall, that how the abdominal wall moves. If you want to practice with me, you can try. I like to have a flat stomach, but we come to the age. Anything you try, it doesn't go away. Breathe out first. Take a deep breath in. Completely breathe out. I hope you're getting there. A lot of people ask me, what is the breathing has to do? Inhalation is sympathetic. Exhalation is parasympathetic. As simple as it is. Breathe in, count of 2 in, count of 4 out. Count of 3 in, count of 6 out. Count of 8 in, count of 16 out. We can do even count of 10 in, count of 20 out. See, whole muscles of respiration is connected through your hand muscles. So if you're able to relax these thoracic muscles with your, say, Brahma Mudra with a Brahmari Pranayam. Wonderful practice. Paschim Namaskar. You can put your hand in the back, do a Namaskar Mudra. Paschim Namaskar. Profound relaxation practice. I posted one in my Facebook. Generally, I don't do much, but I did put a picture. Somebody asked me what the name of the asana. I was in a lotus position called Padmasana. Then I did a Viparit Matsasana. Matsasana is a fish pose. You do opposing fish pose, like you are in a lotus position, you lay down on your mat, then we did a Paschim Namaskar. 3 asanas, Padmasana, Viparit Matsasana, and your Paschim Namaskar. So, what more asana you need? So, I will do a little bit of the Pranayama, which we have all of them for your pulmonary function, but as you know, exhalation longer than inhalation, breath holding. Why? Herring-Brewer reflex, the stretching of the lung, which vagus nerve comes in and says, hey, don't stretch anymore. Stop it. That is your vagal activation. Let's do a little simple, called a pranayama practice. Breathing out longer than breathing in. Touch your index finger and thumb. Spine straight, eyes closed. You'll breathe out first. We'll do count of 2 in, count of 4 out. Count of 4 in, count of 8 out. Count of 6 in, count of 12 out. Count of 8 in, count of 16 out. If you cannot do that, just wherever you can do, then stop and do breathing out longer than breathing in. Let's start. Count of 2 in, count of 4 out. Count of 2 in. Count of 4 out. Count of 4 in, count of 8 out. Count of 6 in, count of 12 out. Even breathe completely effortlessly. You don't even you've been breathing. That is the normal yogic breathing. Dirgha shas, 3-stage breathing. Count of 8 in, count of 16 out. So breathe out first. Let's do it Brahma Mudra with a Brahmari Pranayam. Brahma Mudra again. Touch your index finger, thumb. 4 position of your head. Brahma. Brahma has 4 sides, east, west, north, south. Brahma has 4 heads. The 4 postures you will be doing with your breathing in when the muscle is relaxed. Breathing out when you need all the oxygen. So suppose this muscle is working. So what I do, I breathe in here and the muscle is relaxed. When I breathe out, because muscle needs oxygen during yours. So when you do your back, you'll be breathing in and coming out, breathing out. You listen to 2 body signal. What are they? Pain and effortless breathing. When you have pain, you need to back off. Pain is that telling you, pay attention. You create an imbalancing in your physical body. And effortless breathing means Annamaya Kosha to Pranomaya Kosha. 5 sheath, Manomaya Kosha, Vijnanamaya Kosha, Anandamaya Kosha. Any imbalance you create in physical body, it shows up in your Pranomaya Kosha. And the Brahmari will be doing sound, Brahmar sound, sound of a bee. So breathe out first. Take a breathe in, slowly drop your head to the back. Breathe out with a Brahmari Pranayam. At home, do a few more times. You'll have a profound sense of relaxation. Second one, turning on your side. Breathe out first. Take a deep breath in. Do with your eyes closed. You do a lot better relaxation. Other side, breathe out first. Deep breath in. Third, looking all the way to the back without moving your shoulder. See, I'm having some saliva in my mouth. I've not drank any water in a long, long time. Huh? So breathe out first. Deep breath in. Fourth step, neck rotation with the same sound of a bumblebee. Drop your head down, breathe out first, take a deep breath in. You feel wonderful. Huh? Brahma Mudra with the Brahmari Pranayam. Alternate nostril breathing is primarily a calming and cooling, but primary parasympathetic activation is the left nostril breathing. Left nostril is parasympathetic, right nostril is sympathetic. Left nostril is controlled by your right brain, which is intuitive, which is female, which is cooling, and is called the Ida Nervi. Right nostril is controlled by your left brain, which is analytical, which is male, which is hidden, and is called your Pingala. It's called heating. Suranari, sun energy. Left is called as Chandranari, moon energy. Very important. You know, people say, I'm doing a sunbathing. Sunbathing is great, but why don't you do moonbathing? Moonbathing is complete relaxation. Soma is moonbathing. Chandra Namaskar. Everybody does Surya Namaskar. Oh, I'm so good in Surya Namaskar. Sun salutation. Do a Chandra Namaskar. Chandra Namaskar is cooling. So let's do alternate nostril breathing. Show you the technique. Show you the different steps. And then do your Chandra Vedi Pranayam. Chandra Vedi is doing through only left nostril. You can do left nostril inhalation and exhalation, and you can do also Inhalation through left nostril, exhalation through right nostril. Remember one thing, you always want to see the patency of your nostrils. We do a Jalneti every single morning. So if you're practicing with me, you can test it. Close your right nostril. You don't have to close all the way down. Just close underneath. Is good enough. Breathe in and out through your left nostril. Left nostril is completely patent. Look at the right nostril. Close my left nostril. Through my right nostril. Both are open, but right nostril has a little bit of less opening. You will see in the morning when you wake up, you practice almost one side is almost totally occluded. Alternate nostril breathing opens up in both nostrils. Use your left hand to use your Kanu Mudra, the Dhanu Mudra. Put it over your knee. Right hand, close your right nostril with a thumb underneath. In the left nostril, you breathe out first. Breathe in through your left nostril. Drop your hand down, close your left nostril with the ring finger and little finger. Breathe out through your right nostril. Breathe in through your right nostril. Take a little pause. Close your right nostril. Breathe out through your left nostril. Do with your eyes closed and do it very effortlessly. Exhalation longer than inhalation. Normally you practice until you have any effort. And then you do call it effortless pranayama. If you don't have any effort, generally do to 5 to 10 minutes, alternate nostril breathing. Our daily practice is 1 hour, 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. You will see your both nostrils slowly and slowly going to open up. Then you bring a concentration and a balance. Use a Vishnu Mudra, use the right hand, put your index finger and middle finger in between our eyebrows, called third eye. Close your eyes and bring a focus in your third eye. Then the left hand, hold the right earlobe. This is called your super brain yoga. And also remember, this is activating your auricular branch of vagus nerve. Activating vagus nerve, and you are bringing, this is called a Vayu Pradhan Pranayama. Vayu means Vata. It balancing your Vata. In Ayurveda says Vata pushes Pitta. So when the Vata pushes Pitta, the Pitta is also get reduced. So this is your setup. Do alternate nostril breathing. Do with your eyes closed. In a short time, you will have no idea even where you are, what you've been doing. You'll be in a total transcendental state. You're continuing doing at home. And these are all recorded in your Facebook Live and Facebook page, and it will be uploaded in the YouTube. You'll have the YouTube. The practice are all in my book called Yoga Therapy, Ayurveda and Western Medicine. I'll show my book at the end, my DVD. All of them has these practices. So it's a wonderful practice. The most meditative practice of alternate nostril breathing is called meditative alternate nostril breathing. Most important, calming, cooling, controlling your mind. At the end, we'll do therapeutic meditation, primary for your cardiopulmonary system. We'll do a chakra awakening meditation, and we'll tell you which chakras are connected to which system. Like heart chakra will be a cardiovascular system, throat chakra is your respiratory system. So we'll do a little bit more meditation on those two chakras, but we'll do the balancing of rest of the chakras. When you do meditative alternate nostril breathing, it's alternate nostril breathing without closing your nostril. Initially, it feels like almost impossible, but with the practice, everything is possible. Impossible is possible. Expertise, experience comes from practice, practice, and practice. Teaching is nothing but sharing your practice. Spine straight, eyes closed, bring your awareness to your left nostril. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. You keep on doing in silence, and will find there is a profound relaxation of your body and mind. Close your eyes, do it a few more times. I can clearly see the air is coming out through my left nostril. The air is getting in through your left nostril. The air is coming out through your right nostril. The air is getting in through your right nostril. The air is coming out through your left nostril. So with this practice, I'm having saliva in my mouth again. Just swallow my saliva. You've been noticing me. I'm not drinking any water. Parasympathetic activation. Chandra Bhedi Pranayam. Left nostril. So left nostril is parasympathetic, right nostril is sympathetic. So close your right nostril. Again, with your left hand as a mudra. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your left nostril. There's Vagal activation, activation of parasympathetic tone, activation of vagus nerve. You can do it again, a different way. Breathe in through your left nostril, breathe out through your right nostril. Do not breathe in through your right nostril. Close your left nostril, breathe out through right nostril. Right nostril is closed. Breathe in through your left nostril. Breathe out through your right nostril. Wonderful practice. Chandra, Bhedi, Pranayama. You are in such a relaxed state. You can name any asana. You can do it. The whole body is fluid now. You can name an asana, I can do it. Sarvangasana, shoulder stand, Padmasana, Sarvangasana, Shirshasana, Mayurasana, Mayuriyasana. I've shown all of them in the last couple of sessions. We'll continue the pranayama practice. As we noticed and showed it to you, a wonderful pranayama is a Brahmari pranayama. We showed you at the beginning, bumblebee breathing, Ujjayi pranayama. A Bhastrika pranayama generally is a little bit of a hitting. It's called a prano pradhan pranayama. Bhastrika is an active inhalation, active exhalation. But what it does, if you do it for a little some time, it creates an altered sense of consciousness. An altered sense of consciousness is called hyperventilation syndrome. In hyperventilation syndrome, you develop cerebral vasoconstriction, like blood vessel going to the brain constricts. You get hypocapnia, carbon dioxide in the blood goes down. Your ionized calcium also goes down. So you get a circummoral numbness, you get a carpopedal spasm. And we use it in our clinical practice. Like somebody has an increased intracranial pressure. Pressure inside the brain is high up. We have no treatment. So what do? We put them on respirator, ventilator, do a hyperventilation to reduce intracranial pressure. So let's do it for a short time. And you do it with a very gently, without any effort, before you do our chakra awakening meditation. So Bhastrika is just as if like, there's a bellows, and people in the city has not seen a bellows. Bellows are used to blow your fireplace or blacksmith. This is a technique. You can do a lot of different ways. Let's see, we do all the different ways about 10, 20 times. And we have all the recording here. This is your Apple Watch. You can Fitbit everything. They record all of your body vital signs. EKG getting recorded, heart rate is getting recorded, all the functions are getting recorded. And you notice that I do it quite often. I change my feet. Why? You activate both sides of your brain. I'm sitting down like this. It's not that I'm sitting like this. My body allows me to do like this. Okay, we'll do hand raised, hand on the side, and then we'll do hand from front and back. Then we go to up and down, up and down. We'll do a 10 counts each. And if you want to do it with me, you can do it. First starts from the side. Breathe out first. Outside. Slow speed. Medium speed. This is called your Ishwar. This is a spirit of called Ishwar. Then you call it Soham. Soham. Call it Vishnu. Vishnu is very rapid. And the 10 Soham. Soham. Vishnu, 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 Vishnu. We are completely effortless, and we do it for a long, long time. In fact, you get some little bit of your drainage from your nostril. We do your jalneti every morning. So keep a little tissue. It really helps you. Very simple Kapalbhati Pranayama. Like we'll do another Pranayama again. But Kapalbhati Pranayama is a balloon here in abdomen. It's a diaphragm here, another balloon here. Bring your awareness to the belly button. Push the belly button to the back. Air comes out. Active exhalation, no inhalation. Why no inhalation? I don't need inhalation. The day I was born, I took a deep breath in. Nobody taught me how to breathe in. I need to learn how to breathe out. New to the practice, put your hand in the abdomen, hand in the nose. Nothing moves. Only belly button goes to the back. Totally relaxed practice. Air comes out, and you're breathing in between without knowing. Massaging all the intra-abdominal organs, massaging your liver, your stomach, your spleen, pancreas, your intestine, your colon. For the female is your uterus, ovaries, tubes, man for the prostate. Massaging all the intra-abdominal organs. In fact, it shoots the diaphragm. It massages your lung, so the air comes out. In between lung is a heart. It massages your heart. Very gentle massage. In fact, when somebody's heart stops, we do a massage from outside called CPR, cardiopulmonary resuscitation. So this is like an internal CPR. I sit down, I keep on doing it. My eyes are closed. I do all different mudras in my hand. We'll do another session on the mudras. Actually, somebody asked me that do a whole session on the mudras, especially called therapeutic mudras. Maybe we'll do next session, therapeutic mudras. And mudras in your hand, called health in your hand. A lot of health in the hand. Acupressure is your hand. Color therapy is a color therapy in your hand. These are all part of the yoga. You'll be surprised to know that what is the extent of yoga. You can do sort of hand strength, Bakasana, Mudrasana, Mayuriyasana. Maybe we'll do the mudra in the hand next week. We'll show you all the hand strengths. We'll do Viparit Matsasana. Matsasana is easy. Viparit Matsasana. Viparit Matsasana with your Padmasana. Okay. When the yogis closed their eyes, they saw some color in front of their eyes. And I hear it all the time. People will come and tell me, I was meditating and, I saw the burst of color in front of my eyes. I saw blue, I saw red, I saw orange, But yogis, their laboratory is in the nature. If you see the names of all the asanas, pranayamas, everything, all come from nature. Vrikasana, tree pose, Bhujangasana, cobra pose. If you look at everything came from the nature. In fact, it's called, Sanskrit, Yatha Pindo Tatha Brahmando. Whatever happens in my body is in the nature. A balance between macrocosm and microcosm. That is what Ayurveda is. So they closed their eyes, they saw the 7 colors. What color they saw? Color of the rainbows. The color rainbow, Vibjur. Violet, indigo, blue, green, yellow, orange, red. They assign those colors along the line of the spines, and they call them the chakras. And they assign the chakras the color, assign the chakras with a system of our body: musculoskeletal system, reproductive system, gastrointestinal system, cardiovascular system, respiratory system, endocrine system, nervous system. They're connected with the glands: pineal gland, your pituitary gland, thyroid gland, your thymus, pancreatic gland, reproductive glands, connected with the plexuses: sacral plexus, pelvic plexus. Different colors, same sequence as your Vibjur, violet, indigo, blue, green, yellow, or a violet, indigo, blue, green, yellow, orange, red. Then this is called your balancing of your chakras. The chakras are in imbalance. You can balance with your asanas, pranayamas, mudras, and also finally you balance with your vibration called mantra. Mantra vibrations are called lam, vam, ram, yam, hum, sham, om. And all of them ends with a ma sound. Like in the om, you say a, u, ma. That is your most healing sound. That's why the Brahmari Pranayam, same sound. Let's go at a look at what it is. When the imbalance goes away, you ascend. You keep on ascending at the function, and you develop what is called Kundalini Jagaran, awakening of your serpentine power, Kundalini Jagaran. That is your profound, ultimate relaxation and outcome of your yoga. So Mooladhara Chakra, at the root of the spine, color is red. It has 4 petals connected to your musculoskeletal system. Between your belly button and the root of the spine is your Shadhisthana Chakra, called your pelvic chakra. Color is orange, connected to your reproductive system. So any imbalance in the reproductive system, you balance, you meditate on that chakra. Manipur chakra, or a solar plexus chakra, connected to your gastrointestinal system. Color is yellow. Function of this, the lower function is your power, Mooladhara Chakra. Reproductive chakra is a procreation. You have your generation, and Manipur chakra is a control. Power, procreation, control. These are called your animal instinct. These are called reptilian brain. Then you start ascending up. When you come to the next, to the heart chakra, color is green. That's what your love comes in. It is 12 sides. Then you come into your Vishuddha chakra. This you're connected to your respiratory system. Function is communication. Now you become a human being, from the love to your communication. Then you come to your Agga chakra in third eye. Color is indigo, connected to your endocrine system. Function is your intellect. And finally is your Sahasra chakra, crown chakra. Color is violet, 1,000 petals, and your function is a bliss. If you look at the color, they call it color therapy, and the coloring is the basic colors is RGB, red, green, and blue. But look at the ascending status. When you have a Mooladhara chakra red and your solar plexus chakra is yellow, if you combine this to them, you get orange. You get your pelvic chakra. When you mix your yellow, your Manipur chakra, with your blue, that's your Vishuddha chakra, throat, you get your green, that is your Anahata chakra. When you ascend from your Vishuddha chakra blue to your violet. Sahasrara chakra, you get the indigo. That's your Agga chakra. Okay, let's do the finish with this. We'll do the chakra with the one time in each system, but when you come to the cardiovascular system, Anahata chakra, and respiratory system, Vishuddha chakra, we'll do 3 times more. See, it is a holistic practice, a reductionist, but still we have a little bit of called reductionist holism. We do a little bit more of the one we need for a longer time. Spine straight, comfortable posture. If you sit in a chair, keep your spine straight. If you're sitting in a Sukhasana, Siddhasana, or Padmasana, touch your index finger and thumb. Close your eyes. Bring your awareness to the root of the spine. Visualize a red wheel with the 4 sides, Mooladhara Chakra, connected to your musculoskeletal system. Function is the power, and it's an imbalance. Sound to balance is a lum. So let's all do together. Breathe out first. Take a deep breath in. Lam. Bring your awareness from belly button and the root of the spine. Swadhisthana chakra. Color is orange. 6 petals connected to your reproductive system. Function is procreation. If you have a disease on the reproductive system, meditate on this chakra. Sound to balance is a vam, V like a victory. So breathe out first. Take a deep breath in. Vam. Bring your awareness to your belly button area. Manipur chakra, solar plexus chakra, connected to your gastrointestinal system. So all the functional disease, like irritable bowel syndrome, gastroesophageal reflux, meditate on this chakra. Sound to balance is a rum, or like a Robert. So breathe out first. Take a deep breath in. Ram. Bring your awareness to your heart chakra, connected to cardiovascular system, also the thymus gland. Color is green. Is it 12 sides or 12 petals? Sound to balance is a yum, while like a yellow. We're doing a cardiovascular system, so let's do it for about 3 times. And when you do that, you know, your neck moves, all this thing moves. This is so involuntary, you have no idea it's doing it. So for cardiopulmonary improvement, we do 3 times. So breathe out first. Take a deep breath in. Yam. 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 Bring your awareness at the level of the throat chakra. Color is blue. 16 petals or 16 sides connected to respiratory system. Function is communication. And when you mix your yellow and blue, you get the green. Sound here is a hum, H like in Harry. So for your cardiopulmonary improvement, let's do it 3 times, this hum. So breathe out first. Take a deep breath in. Hum. Hum. Bring your awareness in between eyebrows, third eye, Agga chakra. Color is indigo. 2 petals connected to your endocrine system. So you have a thyroid problem, parathyroid problem, you meditate on this chakra. Function is your intellect. Sound is a shum, S-H, shum. Is it 1 time? Shum. Breathe out first. Shum. Bring your awareness to the crown chakra, Sahasrara chakra. Color is violet, 1000 petals connected to your nervous system. Function is your bliss. Connected to pineal gland. Sound is Om. And again, yogic have 3 components, A, U, Ma, A, U, M, come from the lower part of the lung, middle part of the lung, upper part of the lung. So one time Om. So breathe out first. Take a deep breath in. Slowly bring your hands in front of your heart. This is touch your little finger and thumb. Separate your ring finger, middle finger, and index finger. This is called a Padma Mudra. This is connecting your heart and the mind. Bring it at the level of your heart, real physical heart. The heart is the site of your soul. Say, memorized by heart. Yoga practice gives us physical wellness, mental wellness, spiritual wellness. Physical wellness gives us strength and stamina. Mental and spiritual wellness gives us healing. Bring your hands again together. Put your hands in front of your heart chakra, Anahata chakra. Bow your head down, say Namaste. I honor the divinity within you. You are divine. There's nothing to do with any kind of faith base. This is a spirituality. Spirituality is believing in a supreme power and surrendering. Spirituality is Atma Vidya, knowing yourself, self-discipline, your dharma, self-discovery, introspection, looking inside you, self-realization, knowing who you are, who am I, why I am here, where I'm going. Finish it with another pumping and cupping. Rub your hands, rub your hands. It's a wonderful relaxation practice. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Put your hands over your eyes like a cup. Let the eyes take all the heat. Massage your forehead, massage your eyes, massage your face and head and neck. Wonderful practice. I still have the saliva in my mouth. I want to show it to you. After what, 2 hours, over 2 hours, I've been talking, doing the activation of parasympathetic tone. Oh my God, I see the comments after comments, questions after questions. I'll be glad if I find the time. I'm teaching the whole weekend, today and tomorrow, 8 hours each day. I'll be teaching until 5 o'clock today, tomorrow also 9 to 5. And I'll be slowly answering all the questions. Thanks for participating. Probably next week we'll do probably therapeutic mudras. Huh? Okay, bye.